morning, everyone.
Good morning.
I'm Gina Patterson. I'm the Executive Director of the Virginia School Boards Association, and I have the pleasure of serving as a moderator this morning for this critical conversation on mental health in K-12 public education. You have a distinguished panel today that will address the growing emphasis on mental health in Virginia's K-12 schools and the challenges that are faced by some districts, and how our state is responding with policies and support on local initiatives. So your panel today starts with Senator Barbara Favola from Senate District 40, who serves as chair of the School Health Services Committee. And beside her, you have Chair Sue Dibble, who leads Hanover County's Board of Supervisors and has been instrumental in local mental health initiatives. And beside her, you have Delegate Sam Rasoul from House District 38, Chair of the House Education Committee. So first, I want to thank the three of you for being a part of this panel and your leadership when it comes to school mental health. During today's panel discussion, we'll explore recent legislation, state support for local mental health efforts, and Hanover County's initiative to approach how they have dealt with this issue. So to begin, we know that the foundation of supporting mental health in schools often starts with legislative level issues, where policies shape the resources and programs that are available to our students. So I'm going to start with Senator Favola and then followed by Delegate Rasoul. Let's delve a little bit into the legislative efforts. So Senator Favola, could you discuss any recent legislative measures related to mental health in schools that you've supported or led in the Senate? And what are the immediate and long-term impacts perceived?
Thank you, Jenna. That's a great question. 2 years ago, some of you might remember, the General Assembly put enough dollars in under the standards of quality formula so we could actually reduce the number of students per counselor in our public schools. Our goal was to get down to one counselor for 250 students. I think we ended up at about one counselor for 350. So we're heading in the right direction. At the end of the day, the counselors in our schools need to have a smaller caseload and they need more time with the students. So as a corollary to that, I did pass legislation that actually requires counselors to give 80% of their time to direct student counseling and a reduction of their administrative responsibilities. Many of the counselors had cafeteria duty, or they were leading the buses when they came in during the day, et cetera, et cetera. And when they finished with their administrative responsibilities, they had very little time face-to-face with the students. So that law passed, and it passed overwhelmingly. It was a recommendation from JLAR. I will say that there has been a greater emphasis both on the Democratic General Assembly, the leadership there, and also with the Governor Youngkin, on the value of early intervention on mental health. And the avenue for early intervention is really in our school system. Teachers will tell us they can identify very early on which child is suffering or having a difficult time adjusting or a difficult time with self-regulation. They see it. They understand it, and if we could really intervene at that moment and figure out what's going on in that child's life and how can we help the child get on a better pathway, or perhaps even provide counseling to the families, it will be a very worthwhile effort. So this recently, the model program just ended, but we did fund 15 pilot programs. And they were in school systems across the Commonwealth. And the goal was to empower the school systems to provide some extended treatment after the child is, assessed by the school counselor. If the child needs some additional treatment, to allow the schools to go ahead and contract out for that help. And that money was provided, and we have learned that the schools want more support in figuring out how to build Medicaid in that area, but they liked the idea. So in this last budget, and I do sit on Finance and Appropriations in the HHR committee, you might have been surprised by that, but this last go-round, we also allocated money for a grant program to probably embolden schools and bolster their ability to maybe permanently provide mental health services linked in with whatever they can provide in the schools. And we're doing an overlay right now. We're looking at where the federally qualified community health centers are located throughout the Commonwealth. We're thinking they might be a good partner for the schools, and it could be a permanent home if some of the kids don't have a medical home or their families don't have a medical home. So we're looking at it as strategically as we can. I would encourage you to contact your school boards and to be on alert for our grant announcement for this. It hasn't come out yet, but it's the school's partnership with local community health centers or federally qualified community health centers, so please pay attention to that. I think I'll stop. I know that my colleague, Delegate Rasoul, is the chair of education and health, so I'm sure you have plenty more to add, and I'm looking forward to what Delegate Rasoul has to say. Delegate Rasoul?
Yeah, thank you and good morning. We certainly can't get much done in the House of Health. Some good Senate help, so we appreciate having very like-minded colleagues in the Senate. Look, the problem that we run into, and is not lost on you all, is that we have asked our schools to take care of nearly every ailment in society. We need to nourish the kids. Please provide discipline for the kids. Can you teach them? My child is having a variety of disabilities, and we need the schools to be able to fill in. And we have principals going around in their minivans to pick up kids to meet their attendance requirements. They're putting washers and dryers in the schools so that way they can, some kids were not coming to school because they didn't have any clean clothes. And so I don't know what we're doing as a society, but it's not working. It doesn't make any sense. What we have done, and frankly, some parts of it in a bipartisan way, is make some make some good progress in Virginia in a number of different ways to try to plug the holes. But this is really at least 20 years, if not more, of underinvestment in our schools and critical infrastructure. And it's been tough to watch. So, for example, I about 8 years ago approached the department and talked about the need for social and emotional learning. And the department at that point didn't know exactly what that was. They knew character development, like, you know this word respect, and we should have respect. That's actually not social and emotional development. And now we have introduced a bill, and we've put a task force together. We've built a framework and guidelines, best practices around social and emotional development, because what we do know is that a child cannot learn unless they are emotionally prepared to accept the information that you're trying to give them. And that means that they need nutrition, that means they need proper mental health services, and a whole variety of other things to just get them to the point where they can be then cognitively accepting of what you're trying to provide to them. Fortunately, we've been able, and I will say in a bipartisan way with regards to some mental health efforts, been able to come together and fund some critical pieces. One other concept that we brought together about 7 or 8 years ago was the concept of community schools to Virginia. I watched other states put this together, and they called it different things in different states. There are these two big national organizations. One's called Community Schools, one's called Communities in Schools. And depending on the state, one is kind of more the leader, but the basic piece is I took from Kentucky their model and found that, and then back when we had a Republican supermajority, I called the bill Community Services Efficiency Act. And then all of my Republican colleagues were like, I like efficiency. And what the whole point of that is to be able to ensure that our schools are hubs of services for, not only for the students, but potentially for the community. And fortunately, we were able to build a great bipartisan group of folks and build on that. And this past year, over the past couple of years, we put $10 and then $5 million aside to be able to support school districts who want to be investing in community schools. So what does that look like? In Roanoke City, we have our first true community school, where when they rebuilt the elementary school, on the campus of the elementary school is a doctor's office, not a nurse, but a doctor's office there, where billable activity, the testing, everything that you would see in a normal PCP is happening on that campus. And so the students and the families are not trying to shuffle around and figure out if we can make this work, but they're able to also receive mental health services through the CSB and potentially other community partners in we're calling it the LIFT Center, is our community school model. And what they built in that we hope to activate as well is a dental chair to be able to provide dental services. So the point is that from a mental health perspective, we have to take a holistic approach. And fortunately, we've been able to put some decent funds, in addition to many of the wonderful things that Senator Favola was talking about, into figuring out how we can invest holistically in our schools.
So sticking with that, Delegate Rasoul, how does the General Assembly address gaps, or how do they plan to address gaps in funding and resources for mental health services in school?
Yeah, we are in a fortunate position at this very moment that we have had a great discussion over the past couple of years about where to put additional resources versus making the extremely tough decisions in difficult economic times. We're hoping, especially with the election last week, that we won't have to think about what kind of critical changes might be coming down the pike, but we will continue trying to fill some of those holes. What a lot of us have come to the conclusion is trying to figure out what's kind of the most effective way to do this. We, over the past decade, have had a variety of experiences around the engagement with community partners, some better than others. As you might recall, about a decade ago, the Commonwealth, for better or for worse, began limiting, for example, funding for skill building and mental health skill building, trying to ensure that the efficacy was high enough. Right now, for example, the $15 million that was put aside for the clinics, I think comprehensive approach around the mobile teams that are going out are important. But as a child of a ninth grader, for example, as the parent of a ninth grader, I feel like the child sometimes. When I have a question about my ninth grader, whatever it is in her school, I'm like, the only person I really feel like I should be contacting is the counselor. And so I'm thinking, man, we are just putting to the bill that Senator Favola and I carried, we are putting so much on the counselor. Can you just help me navigate everything? And we have to kind of fundamentally not only say what we did is, schools, look, you need the counselor to be focusing on counseling. But really to get to that gold standard, right now we're at 325, maybe getting to that gold standard of 250 with regards to funding our counselors moving forward.
Okay, Senator Favola, would you like to add to that?
Yeah, I do want to add something. When the delegate was talking about partnerships, one of the things our experts told us was, look to the peers. So I put in a bill that is now part of our family life curriculum, which is teaching children how to support their friend if their friend is having a difficult day or a difficult time, and when should you maybe go to the counselor on behalf of your friend so the counselor knows perhaps I can be a little bit more proactive and intervene if necessary. So we're finding that is actually pretty helpful. Students are going to the counselor saying, my friend is so depressed won't even call me anymore, or pick up the phone, or go out, and blah, blah, blah. So we're finding that peer counseling is actually working, and it's making younger people aware that, if they are struggling with depression or some kind of mental health condition, it's okay to admit that, and it's okay to seek help. I just want to share with you something very interesting that has been modeled in parts of our Commonwealth. And it started in Charleston, West Virginia, and they call the program Handle Johnny with Care. And what it is the police department, as many of you might expect, most of the calls are going out, and they're domestic violence calls. It's about 70% of the visits that police have to make during one of their average nights. So if they're going out and there's been trauma in the family, or there's been conflict or whatever, the police are trained to talk to children who happen to be in that setting, and talk to them about where they go to school, and how they're feeling, and how often do they go to school. So they get a little information. And then the police actually contact the principal of the school. They don't disclose any confidential information on the case. They contact the principal and say, Johnny lived through a very traumatic experience last night. You may want to handle him with care. And so the teachers in the school system, they're aware that, if Johnny's not behaving correctly, it's not because he's intentionally intending to disrupt things. He's just really suffering. And that's another way that the school has the opportunity to intervene. So that's a partnership with the police department. And the other thing that we are doing, it's not directly with schools, but both Delegate Rasoul and I have robustly funded the VMAP program, which is the Virginia Mental Health Access Project. It came to me from a pediatrician, Dr. Chung, and I worked on it many years ago before I was on the Appropriations Committee, but we found that to be very helpful. It provides resources to our primary care practitioners or our pediatricians so they can link a child into mental health services before the child leaves the office. They can either have a mental health counselor on site, they have access to nearby mental health counselors, or they can use virtual programs and virtual consultations. And they also leave the family with a list of resources. So that program has been very helpful as well.
Great. So Chair Dibble, Hanover County has been a leader in developing innovative mental health programs. Could you share some of the recent efforts Hanover County has implemented to support mental health in schools, and what impact have you seen on students and educators as a result?
Yes, thank you very much. Obviously, I'm not here as a representative of our government, but I am here to tell the Hanover story and to tell you a boots on the ground experience of what I've experienced in my lifetime from 2014 to 2020 on the school board, and then in 2020 on the Board of Supervisors, and some initiatives that we've had. So in my third year being on the school board, Hanover County experienced its first student suicide. And as a board member, I love my people. I'm out amongst my people. As a mom, at the time I had a student in high school and was wearing my mom hat in those schools 3 to 4 times a week. So I had a relationship with those students and worked really hard on those relationships. And also as a senator suggested these partnerships with the Sheriff's Office, partnerships with the Community Services Board. So to lose a student on my watch, as I saw it for the first time, was devastating to me. And it only got worse, because the next year there were several students that committed suicide or overdose. And when the first incident happened, I was told, I don't mean any disrespect by this, but it's just, people will know what I'm saying. My government staff told me that was an isolated incident. Not for me. But when it started happening over and over again, I started to ride my broom, as they say. And I said, sometimes that broom goes into turbo.
It's a great line.
It's a good broom.
Ride your broom.
So, we got together as a school board, as a board of supervisor, as the superintendent and his staff, and decided that we absolutely needed to do something and what we believe should be done. And we were the first school district really in the Commonwealth to take a step in a direction. And we believe that we needed to bring the mental health experts into our schools. And so that's exactly what we did. And what we have found is by having these professional clinicians in our schools, that the students are more receptive to going to them, to talking to them in a safe environment. As the senators have said, some of these students don't have the knowledge of mental health help. They don't have financial capacity. And so we're very proud of what we're doing in Hanover County, and that has grown. The first year we had 1 clinician in high schools. Second year we had 2, and now we have a clinician in every one of our school settings. And it really makes a difference, and we have seen a real cultural change in our schools. And as Senator suggested, we also have anonymous tip line. So friends can say, hey, can you check on so-and-so? So we've got a professional in that building that is right there checking on them, giving them some one-on-one time, but also helping them navigate their future, whether it could be some type of a group therapy, bringing their home and their family members in. So I believe we won an award actually for this program in 2022 at Baco, and it's working, and that's the good news happening in Hanover.
So sticking with that, how does Hanover County approach your partnerships? You talked a little bit about partnerships, but can you talk a little bit more about partnerships between the school division and mental health services?
Certainly, we have partnered with the Community Services Board, so the clinicians that are actually in our schools are employees of the CSB. And because they are employees of the CSB, have been able to reach out into these grant programs to grow this program. And so this partnership is so important. These clinicians are working side by side with the counselors, so a lot of the load on the counselors is mental health, which they're not really able to handle professionally. So that's another way that you've had the opportunity to lighten the load, even though it was a numbers ratio, but we've lightened the load because we've taken some of the mental health off of those. So
I just want to add sort of a best practice that you may want to consider. A couple of years ago, I helped the federally qualified community health center in Alexandria get a grant for a mobile mental health, we call it our mobile mental health, or our mobile mental health train. It's actually just mobile mental health. It was in a bit of a bus, and we made it very cute and pretty and all that, but it went to our middle schools, and they were there 3 times a week. And again, the professionals got to know the children. It wasn't a direct burden on the counselors in the schools. Now, the counselors did have a relationship with the folks that did the mobile mental health unit. So, so there were some referrals, so the folks that were in the mobile mental health unit could reach out to children who were identified by the school counselors. But the point was is they actually did get some ongoing treatment, and it was right there. The families didn't have to go anywhere. The child didn't have to go anywhere. They did have a family night talking about, trauma-informed care. So they tried to be as comprehensive as possible, and they were really reaching an audience. Many of the children that used the mobile mental health unit needed additional resources. And so that was a good way of linking them into resources that they needed to help help them and help their families.
Okay, so this is for the three of you. What are some key factors you think enable the development and sustainability of these programs? And are there funding strategies or partnerships that could be replicated in other counties so that our audience can see actually some best practices, things that they can take back and maybe do in their own areas?
Well, I gave you the mobile mental health unit. That was one idea that I think I would encourage all of you to go out and see if you can find a partnership with your school system for that mobile mental health unit. But there are lots of other opportunities. I think Delegate Rasoul may have some ideas as well.
So, yeah, thank you. So what has been expanded upon, this is very important for all of your localities. What's a little different this past summer is that the rules have changed around, and the senator had alluded to this, but we're maybe not taking full advantage, around the locality's ability to be able to bill Medicaid. And you need to go back. My understanding is that currently about 106 of our localities collectively bill Medicaid in some fashion. However, now there's an expanded ability to be able to provide additional services and bill Medicaid directly. What we need to be doing and what we're looking at the state level is to be able to provide additional support in doing that, whether that be potentially some IT support or technical assistance through additional members in the department that can help you set those processes up. But I think that there's certainly for Virginia, there are many, many millions of dollars sitting on the table for a variety of services to be able to offer. So that's number one. Number two, downstairs, you heard, if any of you were in that session, it won't last forever, but for the next several years, we will have a decent amount of OAA funding that you all are receiving directly, but also that you have the ability to apply for separately from what you receive, especially if you are collaborating with other localities. And so applying to the OAA directly for some of those funds, whether it be, and by the way, what you can use those funds for is pretty loose. It just needs to, it's pretty flexible, I shouldn't say loose.
He meant flexible.
I meant very flexible because we're being recorded. It just needs to, like Jeremy said, can we stream this?
No.
No problem, no problem.
Thank God for the Senate.
That's right. But it's great because it actually gives you all a lot of latitude to be able to say, how does this tie back to substance use disorder? And there's lots of things. So for example, if you had a program that was doing professional development around that, you could be funding that potentially through AA grant as opposed to some kind of direct service. So clearly the state needs to be able to step up and do more. While we've done some, we need to do more around counselors, around supporting more, especially telemental health opportunities, especially for some of the rural counties, and offering some incentives to do so. We have some, but broadening that. And then one kind of void to your point. You reminded me, I ran for local office once, and thank God I lost. Local office is tough. A lot of what we talk about, that you hear at the state and federal level is a lot of Republican and Democrat stuff. And we work together pretty well on a bipartisan basis in Virginia. However, at the local level, that's really where you got to figure things out. And so as a reminder, thinking about substance use disorder, we hardly really have any resources for children as far as inpatient resources for children in the Commonwealth. This is a critical, I think, void because it's so difficult for us to determine how to best approach some of the state resources. So certainly we provide resources to private providers in different ways to be able to care. But we certainly need to be able to, from a mental health perspective, I think, do more as a state, and we're continuing to explore that.
I just want to add to that, a major piece of helping the schools provide mental health services or link the children into mental health services is probably working with your community services boards, right? Everybody here has a CSB, and some localities are actually putting local money into the CSBs in addition to what the state's putting in. So the county board member from Arlington is going to say, I did serve on the county board as well. I know Arlington put plenty of money into the CSB, but a lot of you have, because you want to bolster the services, and the state funding for CSB has not been as sufficient as it should be. So my suggestion is, if you are putting local money in, maybe you add some language to the appropriation about using this money to bolster access for children. And they can be creative, but you're putting local dollar, on the table. I think you can shape a framework around it. And that's something I'm considering, as we continue to evaluate the request for increased funding from our CSBs. I'm wondering if I can, maybe target some dollars to improve access for children, both suffering from substance use disorder and mental health issues. And perhaps we can really help you nurture that relationship between your CSBs and your schools.
Yeah, I'd just like to echo what my colleagues here are saying. We need to do more. And this really is a bipartisan issue. And that is an important issue that we do agree on, that we do need to do more. And these guys are, I know, kicking and fighting and trying to do more. The other thing that I believe is that our children are our best asset. They are the most important people that I serve. And I'm going to continue to advocate with these guys to help us possibly. We put a lot of local money in and help our CSB, but the CSB and the schools working together is really where it's happening. It's making a difference. We have been doing this since 2020, which is not a long time, but it's enough time to grab some data and to have feedback from our students that are saying it's so much easier for me to come to school. I feel safer here. I feel like I can communicate my feelings with my family. When you hear those things, that's success.
That's right.
That is success, and that's why we're all here, and that's why we're all going to continue to do more together.
Great. So as you all know, the collaboration between the state and the local government, as you just mentioned, is essential to the effectiveness of the mental health support. To Senator Favola and Delegate Rasoul, what steps can the General Assembly take to better support local governments like Hanover County in their mental health initiatives?
Thank you, Sue. Sue said she set me up really well. Well, let's just be clear. I think the state really does want to be a partner with local governments. We understand that you are really where the action is, and you're on the front line. You have to shape programs that can actually be implemented. You have to shape programs that can be funded and sustained. And you have to look at it through an efficiency and effectiveness lens. I get that. I spent 14 years on the Arlington County Board. So I do understand local government and have a great deal of respect for all of you who every day have to face these problems, probably in a more compelling way than the lawmakers in Richmond have to face them. So I'm open to suggestions. I know funding is important. What I used to hear and what I still hear is local governments really want flexibility. They believe they can address problems in a unique way, and each locality has a different set of assets. Each locality has already established partnerships. You can do more. I think you're best served if we can give you best practice models, and then you can take that and adapt them to however you think might work for your community. But frequently we're asked what works. We should be able to tell you what works. We can look across the Commonwealth. We frequently have contracts with universities to do evaluations for us. So I think that's a good step the state can do. The state can, as I said, can put in more money. And the state can also target its programs to bolster that goal of increasing the availability of mental health services in our schools. And I'm certainly willing to do that. And I would encourage you to work with your school boards and the Association of Superintendents. Well, Jen, I know you're very active. You're an active voice for the school boards. But we want to hear what school boards have to say as well. So.
Delegate Rasoul?
Yeah, thank you. You know, it's really tough, I think, on some of the rural and smaller school divisions and localities to be able to have the advocacy that they need. And you know, I think that the key to changing public policy, 95% of it is advocacy. It's the organizing, and it's not better ideas. We generally have a lot of good ideas in front of us. It's a matter of trying to determine which of these awesome ideas should we be taking up, and then, more importantly, then funding. So when you're thinking about your efforts, I would, if you're finding yourself spending a whole lot of time talking about the General Assembly and devising the right exact words of the policy that you're going to put before us, you're probably not doing it exactly right. You're going to make sure that you're working a good chunk of your time on what's my advocacy plan. How are we going to actually work in coalition with other jurisdictions, number one. Number two, you know, we're a 7-member board or 5-member board, etc. How are we going to divide and conquer and meet with our collective legislators, not only locally, but those who are pivotal with the issues, meaning they sit on those committees or chair those committees. I think that that's important. And then lastly, I think everybody knows this, but just as a reminder, we have a short session and we don't have time for a lot of in-depth conversations. And truly our role now as part-time legislators, which this is, like many of you all, probably a very full-time, part-time job that you have, our job has really turned into a year-round job. And so year-round advocacy. So in other words, I had the joint committee talking about school funding that's been going on this year, for example. Senator Favola around school health resources. You know, we're meeting all year. And so your advocacy efforts to deepen those partnerships, you know, come to those meetings, make sure that you've got a voice in those agendas, because I know Senator Favola will second this. A lot of the bills that we carry going into session are consensus ideas that come out of those task forces, commissions, work groups, because we've spent time talking about it in the off season. And the session is really not the best time to discuss the idea. It's the best time to make sure that people are hopefully supporting your idea.
All right. So Chair Dibble, how would additional state funding or policy changes enhance Hanover's mental health programs in your opinion?
I'm going to answer that question, but I also want to piggyback on this. And I think that was a great point that we as supervisors need to have relationships with our House and Senate representatives. And not just during session. We have this legislative day and visit your Senate, and it really is not it's a good use of time, but the real work gets done months before that. And it's you sitting down with lunch or dinner or whatever, one-on-one with your representatives. And that's how you're going to be effective. You know, Buddy Fowler is my representative in the House. We talk all the time. We meet for breakfast all the time. I also work with Senator McGuire and Congressman Whitman. And so we have these very close relationships. So he constantly knows what my challenges are in Hanover. so that he can be thinking about that as he's thinking and drafting legislation. So we're not going to meet for 30 minutes and come up with a bill. It's just not going to happen, but please, I encourage you all to develop those relationships because they're so important. And obviously, the flexibility in this grant money is important for all of us because larger divisions need different things. These smaller school divisions, they need something a little bit different. But at the end of the day, we need more dollars to serve our children. So, thank you.
Thank you for that. So, Delegate Rasoul, you were talking a little bit about your advocacy plan. How can the state foster community dialogue on mental health that translate into action? Are there community-based models in Virginia or other states that we could implement? I know you mentioned, I think you said Kentucky, but are there others that we could expand on?
From an advocacy perspective, whenever someone comes to me and they want to get involved, I always just say you need to find an entity that's doing this already and join. So if it's ARC of Virginia or whatever it may be, get on their listserv, join their regional groups. Is important. I would say that generally speaking, statewide, we probably don't have very healthy systems for dialogue. It's probably a little easier in some of the more populated areas. And as the only Democrat elected in the western half of the state in the legislature, I can say a lot of these localities, people are just trying to make the dollars work. And it's a little bit more difficult to try to figure out how to have this conversation. But look, today, one of the tiny silver linings, and I'll say that as tiny as it can be, from COVID is that I believe that we've become a lot more accustomed to and a lot more comfortable with, a virtual setting. And that gives us maybe an opportunity to find more creative ways, even than just a generic Zoom, but creative ways of trying to engage virtually in getting more community input and trying to build those advocacy efforts as we move forward. I will say kind of, advocacy is a chess game in a lot of different ways. And the best advice that I can give to you all, and I say it to every locality in my region, Peter's here from Roanoke County, and I say it to Roanoke County, and they do a good job. And this is not a partisan statement, but if you're playing the chess game, and if the General Assembly is Democratic in the House and Senate, then don't get in the paper for something that isn't good news. And so no matter how passionate you are about banning books, just don't get in the paper about it, right? Like, so that way, why this random county, they're talking about all these, okay, I understand, that's fine. But, the best news is good news. We want good news from your county so that way people feel good. And when you have an awesome program that in Hanover County, you're like, we're doing this great thing. And there's so many wonderful things happening in each of your jurisdictions. Just make sure, it doesn't become a political target because of just, these kinds of hyper-partisan issues. So that's my best advice. I'm not telling you how to think about any of this stuff. I'm just saying, make sure to remember that the best news is good news, and it makes everybody feel good about the work that you're doing.
I guess my advice is try to clearly and specifically define the problem you want the General Assembly to solve. I mean, coming to us and saying we need more help providing mental health services in our schools is not going to give us the information or the tools we need to really help you. Now, if you come to us and say, we really need more funding specifically to hire more counselors or to reduce the caseload, or we need a grant program because we want a mobile mental health unit to visit our middle schools to do the following. So be as clear as you can, and it also helps us if you show us where your ask sort of fills in a gap. Because the next question lawmakers are going to say is, okay, what are you doing as a county? What do you already have in place? how does your ask really complete the safety net? And then, once we get that down, I would say that what you're asking for is probably a common need throughout the Commonwealth. And then you can really start building friends. Because if Hanover is asking for something very specific, I bet Arlington and Fairfax need the same thing, and I bet Weiss County probably needs the same thing. They may want it delivered differently, but I could get it under that same rubric. And also, think about pilot programs. It's very hard for the state to put enough money in to fund things statewide. So if you come to us with an idea that you believe will fill a gap, that you're willing to evaluate, which is always helpful to us, give us some information on how well it works, and you think a pilot program would be pretty good, and you thought about it, maybe you can help us identify 3 to 5 jurisdictions, and then we can come up with a dollar amount. That has been a recipe for me being able to pass a lot of helpful legislation or get helpful appropriation language through. So I hope that does give you something to think about and maybe a few tools. I will say that the mental health services, the provision of mental health services, reducing substance use disorders, starting treatment programs, has enjoyed a fair amount of bipartisan support. So in that respect, you're on very good grounds. And being a local official, I used to say, when I was a local official, okay, if there's bipartisan support for this, and we need money here, we're going to go and ask for money in this particular area. That will free up resources to do some other things that you need, which the General Assembly may not be as uniform about providing, or you may not have the trifecta that you need to get it through. So I'm sure you're all very talented, and you've had to balance many budgets, and I'm not telling you anything you don't already know, but sometimes just hearing it in a different way might help you. So thank you.
Okay, so with that, there are limited resources. So how can school divisions prioritize mental health without compromising the other essential services they already have that they're doing?
Well, I would say, since there is a lot of support for mental health, I would ask for the additional funding in the mental health space. So you, in effect, you'd be able to free up some resources that you might be using in that space and put it into public education, or put it into public safety, or whatever other challenge the county might be facing. But the state wants to be a partner in this. I think you should engage us, and engage us in a meaningful way if you can. We want to make a difference. We want to see a difference. We believe in investment in mental health. Serving our children will save the state money in the long run, and will be the kind of thing that builds a healthier society. So, and that's been articulated in various words in different venues by Democratic leadership and by Governor Youngkin.
Chair Dibble, what about you from the perspective of, so you've been previously on the school board and now you're the chair of the Board of Supervisors. How did you all go about approaching that from Hanover County to make that as successful as it has been in your division?
Well, as you may or may not know, Hanover County has an appointed school board. So I worked very closely with my appointed school board member, who is also the chairman of that board. So we were joking about that earlier, Gina and I. We communicate very well because I'm the boss. So, but at any rate, we make great strides in working together and make a concerted effort to work together, understand each one's needs. And so when you have this mom on the Board of Supervisors who's lived through some traumatic things while her children were in high school, it's very easy for me to advocate my colleagues to put some money in from the Board of Supervisors from our tax base. And I think what we would hope that we could do with their legislators in this flexibility of this grant money with maybe some of this match. A local state match might be something that we could look at for us, but we firmly believe that getting professional mental health clinicians in your schools works. We have the data to prove it, and the statistics and the environment, I can personally tell you, the environment in those schools is so much better. Our children are staying in schools, and they're going to be able to meet their life goals. And that's my goal. That's our goal.
And I think that's well said, Sue. I just wanted to add one thing. You might be thinking, well, it's difficult to hire healthcare professionals because there's been a shortage. 2 years ago, Virginia did enter the National Social Work Compact. So there's a reciprocity with Virginia is part of, I think it's 28 other states. Don't quote me on that, but there are a large number of other states that are in the National Social Work Compact, which enables us to, it expands the pool of individuals who would be eligible to be hired in Virginia. So we're working hard at the pipeline. We've bolstered scholarship programs for folks going through the mental health track, professional track. So we're trying to help as much as we can with the workforce issue.
All right, so as we start to close up this afternoon, I would like each of our panelists just to share any final thoughts they have, and then I'd like to be able to open this up to audience participation.
Well, I've really enjoyed this panel discussion, and I'm looking forward to questions. I don't think I have much more to add. I want to hear what you have to say. So thank you.
And I'd just like to say it's been a wonderful experience to sit here with legislators and kind of banter back and forth, but most of all to share and to show you how we can truly work together and share ideas and collectively move forward with your help.
Well, I think you just described your next bumper sticker for your next campaign. It's like boss on a broom. Boss on a broom. Getting it done, that's for sure. The only thing, as we get into your questions, the major thing is that we have to have, we've already talked about decades worth of underfunding and lots of infrastructure, specifically in schools, but certainly to our localities. And so we have to have honest resource conversations. And so when we are hearing that we have a surplus or excess funds at the state level, and you hear an idea about sending a couple $100 check to people, I understand that sounds good. That cost us $1 billion. Think about what $1 billion could do for our localities in so many different ways. So I get it. Like, it's not that it's a bad idea to send that couple $100 to somebody, to people, and people certainly appreciate it. But that's a drop in the bucket, and it just makes us feel good instead of saying, well, let's make the real investment that we need to, because remember, it's not, we're trying to patch the holes from decades of underfunding. So we need your help, and we need to have a collective conversation just to be honest and say, all right, look, we want to make sure every dollar is accounted for, everything should be transparent, we shouldn't be wasting anything, and at the same time, let's make the critical investments we need to move forward and not fall for these conversations around either a check or some other plan that isn't really trying to address some of the real problems that we're having at the local level.
All right, now we'll open it up to questions. Does anyone have any questions on this? Yes, please.
So this might be a question for you.
Okay.
This is great, and I especially love the tip about, if there's a place where the General Assembly is agreeing and move resources there, and then diversify your budget a little bit. She's the boss of an appointed school board. That doesn't happen to most of us.
Yeah, there are only 9 appointed schools.
So, what's the best way to get into the nitty-gritty with your school board where you can have this type of conversation where we as the board of supervisors are concerned about mental health? I don't even know what our school board's doing about mental health. So how do we, without threatening them that we're getting into their territory?
Well, I mean, right, you don't want to look at it that way. You want to
Right.
look at it as a partnership
Right.
because it benefits both parties to
Yeah.
have this taken care of. So just start by having the conversation. I mean, the door is open that we want to have a conversation. It's just that easy. You'd be surprised how many board members say they can't even have a conversation or that they don't try to have a conversation.
All right, thank you.
I'd
Thank
like
y'all.
to piggyback on that as well, because as board of supervisors, their relationships with their senators and their House of Representatives is important, but your relationship with your school board member is imperative, because you guys work a budget together, you need to understand their needs as much as they need to understand your needs. So I would say, if your relationship with your school board members is off, you feel, that should be your number one priority.
I don't know that so much that it's off, it's just very territorial, and I'm a former school board member 10 years, so I
get it. It
I
is
get
very
it.
territorial.
but it's just getting tougher and tougher, I think, as resources are so limited for all of us, and they feel that too, so. But I very much appreciate this conversation.
Well, one thing we should keep in mind, Senator, as we move forward, is maybe in some of the grants that we offer to delineate, because we just think of localities as localities, but to delineate either a matching function or partnership to say, all right, we expect from your school's budget, X, from your locality's budget, X, and there needs to be a collaboration, and you need to jointly provide the state a plan.
Yeah, thank you, Delegate. I would just say, though, that when the program managers evaluate the grant applications, they very much look for the partnership. They look to make sure that the county has signed off, and that it's usually the CSB in the county that's playing a big role in the provision of the mental health services. But yes, I mean, articulating that is a good thing. And then, of course, having both the school board and the county board of supervisors or the governing body is also helpful. But that's a key thing when you're applying for grants. These partnerships need to be articulated.
Sir?
I have thoroughly enjoyed the dialogue of the three of you and the questions that you have thoroughly enjoyed. The grant announcement, will that go out? How soon? When? Where? How long? How much?
May I get back to you on that, because I don't know when we're going to get that grant announcement out for this partnership with the very qualified community health centers, but I will work with VACO staff, and they'll get a notice out in the newsletter, which will be accurate. I don't have the accurate information right now, so I'll be able to tell you when to expect it, and maybe what the grant outline should look like.
Okay, my second was, I just left a budget hearing for the state. My second page, it says state finances are quite healthy. That is quite disturbing with the concerns we have and the needs that we have in the state of Virginia. Nailed it.
And can it's important to clarify, and thank you, I appreciate you endorsing what I said. So you're on my campaign now. The way Virginia works, as a reminder, because I think everybody kind of works that way, is that we're on a cash basis. And so what's healthy about it at this very moment is, we've left our budget behind us for many months, and we've had many months of collections, and those collections are now just sitting there and piling up. And it's not that we have been sitting there for a couple of years, per se, with this excess reserve, outside of the actual reserve accounts, which are very healthy too. So now we're going into this General Assembly session, I think, able to make some decisions there, because the cash on cash has been healthy.
I just want to reiterate, and this is not news to any of you, but I mean, our growth was robust. It was beyond what we had anticipated, but let's just be clear, we usually have a very conservative estimate in terms of what the growth will be, because we don't want to be surprised and we can't by law overspend. We have to have a balanced budget in Virginia. but we don't know what the future will hold. And if we give a tax cut, then that money is gone, and we're not going to recoup it. If the economy were to slow down, then we've missed an opportunity to make investments, and you all get about $300 a year. But we've missed an opportunity to make serious investments in teacher pay, or smaller class sizes, or giving you money for your at-risk schools, or giving you more money for community-based policing, your 599 funds. If we don't take the time to do that, and we give a tax cut, we won't ever be able to make up that investment. And we don't know if we'll be able to make up that investment, because the economy could go into a recession. So it's really, really important that we use this revenue wisely. And I do want to note, just so you know, we've got a $700 million hole in our budget because of Medicaid. More individuals have become eligible, which is fine. Cost of services has gone up. But a $700 million hole over 2 years, which will eat into some of that surplus.
Sir, are you not done? Go ahead. Are you not done?
But as long as we put more emphasis on the healthiness of the fund we have here, and we don't address those critical needs, mental health, we've been ignoring for years. And the level of investment into our educational institutions, we have been ignoring for years. Because I know the economy has forced our weakest link is the time the kids get off the school bus until they get back the next morning. And that's where all our problems are. From the time the kids get off the school bus until they get back the next morning. And somehow or another, we have to address that element, that weakest element, in terms of educating our students. And if we got a healthy budget and not addressing that healthy doesn't look good anymore in my eyes.
Taken. I think there were a few people with questions. There was a gentleman.
There was, sir. Yes.
Yes, Senator, not knowing the particular job of counselor, how deep would you tell me, if you could, how deep counselors can go with students as far as the information pertaining to parents' abuse or neglect?
Well, I do spend a lot of time, and I've had a lot of legislation in the child welfare space, and you know counselors are a mandated reporter. So they do have to make a determination if they feel the child is being physically abused or there's neglect. They are required to report that to Child Protective Services. It's a judgment call on the part of the counselor. And hopefully the counselors can be there to provide whatever insight Child Protective Services might need. Perhaps your family assessment program team, your FAP team, can get together and evaluate the family situation. But it is a challenge. I mean, we want an early intervention though. So, and I think counselors understand that. They know that they need to intervene early, and they can either go the FAP team with the behavioral health assessment, or if they feel it's such a serious abuse, then they have to report it. Yeah.
Thank you. So my family is pretty healthy. We try to take care of ourselves, and so I just went through a 14-week prep for bodybuilding. And I'll tell you, if we're not looking at how nutrition is having an effect on our children's mental health, we really, really need to, and how those overlap, and how we can provide food for them all the time, no matter what. I know some of you already believe in that, but when our brains don't have glucose, we can't learn, we can't think, we have brain fog, we can't function. It affects our hormones when we're depleted. It affects everything. Your cortisol can spike easier, behavioral problems, and then the quality of nutrition I think we need to address after we just make sure they're getting fed. I think if that's not a conversation in this, it really, really needs to be.
Well, we had a bill from Senator Roan in the Senate, which she wanted to expand the school lunch program, so every child was covered. So if they were eligible for SNAP rate, if they weren't, then the state would be putting in dollars. So yeah, we are aware, and I know a lot of school systems are not teaching nutrition. classes, which is great, and many school systems have intentionally come up with better meal plans, more nutritious meal plans, so I'm grateful for that. So that's just something you need to look at probably with your local school board, but yeah, very important
I
point.
was gonna say, that's a great conversation to have with your local school.
I have, and I have a great relationship with my school board member. Are you all having that conversation in the context of the mental health as well, though? Is what I'm wondering. How this cross.
No, I don't think so. My wife and I are a bit of foodies, and we do talk about, we absolutely are having the conversation of the kids need to be fed. Like that's,
Yeah.
there's a lot of passion, and that's happening very robustly. The quality of the nutrition
Yes.
is another topic. You know, this comes from somebody who believes that our food is slowly killing us.
Yes.
And so the from microplastics to PFAS to, I mean, you just kind of go down the list. But then beyond that is just kind of the basics of ensuring you've got, you know, well-rounded nutrition. You know, fortunately, it has been on the national radar ever since First Lady Obama, you know, really took that up some years ago. But we haven't had a way in the state to kind of talk about the quality of the nutrition, I think, as robustly as it needs to be with so much, you know, processed food. I have a lot of parents and school board members who are like, I wish we could just get these vending machines out, or this, that, or the other. I mean, there's always a variety of conversations there for sure.
Sir in the back, I think it was you.
First of all, thank you for bringing mental health to the forefront. I've been a teacher for 19 years. I'm still a teacher.
Bless you.
And this is a big issue, you know, dealing with high school kids. And they're still kids, you know, yeah, they're high school kids, 16, 17, 18 years old, but they're still kids. That this topic is you know, really touchy-feely because you got a stigma around mental health. And that's the issue. It's like, how do we break that wall down around stigma? Because mental health is a disease. And, you know, how can we fix it? How can we help it? Too many times I've seen students go down the wrong path, make the wrong decisions. They don't have the backing at home. Like the gentleman said in the front row, you know, we're with those students more than they're with their families. And that's where a lot of the problem lies, is once they get off that bus and go home. And they bring all that package and all that drama and all that hurt and all that hate back to school. And how can we work on this? The counselor thing is great. I think we really need to look at that number, bring that number down to around 100. You know, because you cannot manage effectively over 100 people. And the counselors still do a lot of work with scheduling and everything else they do. And a lot of localities, especially the rural localities, are still going to use them wherever they can because shortage of substitutes, teachers, and everything else. So they get thrown and pulled away where they don't get the time to talk and interact with the most needy. And the biggest return that you're going to have on investment is what? Young people. Put the money in the right place, grow those young people so they can be successful citizens.
So I'm going to make my pitch around social emotional learning and the development, why that has to be like priority number one. And I'd be putting the professional development dollars for your teachers and others into that, and the difference. So for example, when I was in school, the DARE officer would come in and say, here are all the drugs, they're bad for you. Here's a picture of your brain on drugs, don't do drugs. All right, then we have now curriculum that comes into the second grader and knows if I want this kid in sixth grade to not be smoking cigarettes or doing something even worse, in second grade, I have to get them to be able to recognize the emotion that they have and then build a skill to be able to deal with it. And the resiliency has to be there before they get to 5th and 6th grade, or else they are ready to be making bad decisions. If you think that these middle schoolers, I mean, you all know, these middle schoolers, not only are they taking their lives, they're having sex, they're doing drugs in middle school. And so that means in 1st grade, 2nd grade, and 3rd grade, building those resiliency skills, and there's specific curriculum around it. I mean, I really think that a third of the mandates that we have from an SOL perspective, we should just get rid of them and replace the other third of the day with just SEL stuff, which is integrated into, you know, how we teach. I don't want to shake it up too much because we're almost at lunchtime. But the reality is, I think that that's where we should have a big investment.
I have a very unique situation, whereas I'm on the board of supervisors in my locale, but I also work for our local school district. And I would like to see a lot more resources for teachers, because we talked a lot in here about counselors, but like the gentleman said back there, these kids spend the 95% of their time with their teachers. And I see teachers every day leaving because, hey, Johnny is choking her because he's hearing voices.
Yeah.
You have classrooms that have to be cleared out because kids are flipping desks because they're hearing voices or other mental health issues. Also, as far as kids coming to school high, and I'm at an elementary school, and I see first graders that come in the morning high, and by the afternoon they come down off of their high, and then now they're ready to go to sleep because hey, they're off of that high. Sometimes they come in the morning and you're doing car line, and the marijuana smoke is so strong coming out the car that sometimes you wonder, did the kid have one on the way to school too? But you know it's the parent. So, and I know that plays a large part in that mental health piece. And as a mother and a wife of educators of over 20-some years, we have to have more resources for teachers. In my school district, we have DARE, we have community and schools in every school in our district. We have therapeutic day treatment counselors. I also see some children falling through the cracks where their insurance, because they have a certain type of Medicaid, that provider doesn't take that insurance. And so they're falling through the cracks because their insurance doesn't qualify them for the service. So I see those things every day.
We agree. There's a relationship here between providing mental health services to our children in schools and also bolstering our school system. You know, if teachers had smaller class sizes, if teachers had teacher aides in every class, if we had school nurses, which my committee is looking at to try to figure out how to help the LPNs become RNs if they will agree to continue to serve in the school system. So we're trying to look at this in its totality, but I thank you for bringing up that question. We do understand that an investment in our public schools is absolutely critical if we're going to be trying to integrate good mental health services. Thank you.
Our last question right here.
Yeah, I want to reiterate and thank you for bringing that up, and sir, thank you for being an educator. But we've heard a lot, again, what she said, we heard a lot of talk today about the mental health services for students, okay, but not necessarily the educators. And anybody who's hands-on in the school system knows post-COVID education has dramatically changed in the school environment for the educator as well as the student. Bus drivers, cafeteria workers, all the way up the line, they've all been impacted by this. Children born during COVID are now entering the school system. They suffer from poor social skills, poor listening skills, poor self-control. The teachers are having to deal with the fallout, the educators, the cafeteria workers. You need to better prepare our teachers, our paraprofessionals, our support staff, not only to accommodate these COVID kids' educational needs, but also to deal with the mental health issues of the educators. I am a 30-year teacher spouse, and my wife retired November 1st because she just couldn't take it anymore. And she loved teaching preschool. She's been in the VPI program for 6 years, I believe, and she had to walk away November 1st because of the mental health of educators. And there are people leaving education in droves, and we have got to address the mental health of not just the students, but we need to talk about the adults in the room too.
That's an excellent, excellent point. And it is amazing to me we have individuals who still want to enter teaching. It is a challenging profession. And this is an area where we have not gotten support from the governor on public education. He's had a different view, and unfortunately, I think that has caused to undermine some activities that folks wanted to implement regarding the need for more funding for public education. But this last budget, we did put in $1.5 billion over our current previous budget. So we did give a big delta. We are increasing teacher pay. So right now, we're about in the middle of the pack. We can look at the average teacher pay across the Commonwealth. I think class sizes are probably still too large. We're increasing money to our at-risk youth in schools, so we know that schools are challenged with, you know, a high percentage of children on IEPs, a high percentage of children English language learners, and you're educating everybody, but it takes more resources to educate some children than an average student, say, and we have to adjust for that. I think teachers need mentors. We're looking at mentorship programs. We're looking at leadership training for principals, so they'll better be able to support teachers. And we're looking at empowering teachers. Surprisingly, I was at an educational summit, so was Delegate Rasoul, and some schools did surveys on why teachers were leaving, and they did not indicate pay as their top reason.
That's right.
They indicated other reasons, some of which you just said. They needed more support from the administration. They needed more flexibility in curriculum development, or they needed an assistant. But most of them loved teaching, and they would have continued to teach even if the pay didn't go up. So we're looking at all that, but we get it, and thank you. We do meet with educators quite a bit, simply because of our committee assignments, and we will continue to do so.
All right, thank you all.
Thank you.